I have a deep love for this country. So from the moment I went to Hopkins, it was with the intention to come back to Bangladesh and work here as a public health professional. There's an unconscionable thing taking place out here. That is, mothers and children are dying needlessly.
We have one MW here who died.
We're looking at roughly 11,000 mothers dying from pregnancy-related causes, and well over 250,000 infants who die in this country every year from likely poor nutrition. We're trying to look at whether or not improving the nutritional status of women and infants, particularly through vitamin A or beta-carotene, will prevent some of those deaths from occurring. If we find that this intervention even reduces 20% of those deaths, we'd be looking at saving about 50,000 infant lives per year in this country. We've got to get the science right, because in countries like Bangladesh, where resources are scarce, if we make recommendations, we want to make recommendations that are sound, that are based on scientific evidence. And so our job here is to get it right. Once we get it right, it can move mountains.
This is the first step in that chain. Asking a question, finding the answers, developing a program, and then improving lives. At Hopkins, the thing that we learn to be is internationalists. We become scientists for the world.
Good morning and welcome. I'm Mike Ward, the Associate Dean of Student Affairs. Welcome to the Bloomberg School of Public Health. And more importantly, congratulations. Congratulations to all of you. That was a really powerful video. I'll tell you, this is a great place because of the work we do. And I'm going to tell you just a couple things that you already know and some conversations I've had just recently about admissions, where I'm going to ask you to congratulate yourselves as well, that this is a very competitive process to get here. So I was having a conversation just the other day with some of my colleagues in one of the departments, and I would say probably one department that's not always perceived as the most competitive, and they were really talking about struggling with which students they were going to invite, which students were going to come, and they had 20 slots and about 200 applicants that were there. So the seat you sit in, I would say, is very coveted. So I would, one, congratulate you again and welcome you to congratulate each other with a round of applause. So congratulations. So as Associate Dean for Student Affairs, I have this duty. Somewhere there's this book for deans, and it says you have to always talk about the history. So I'm going to give you a little bit about the university's history here. As you can see, is founded and opened in 1876. And one of the things I think was really important then and today is some of the words from the university's first president, President Gilman. The encouragement of research and the advancement of individual scholars who excel will advance the sciences they pursue and society. That is so important, was so important then, and is so important now. And that message, I would say, as you take that message, the early foundings in the university really looked at a German model where students came to follow and to work with particular scholars. And today, being one of the, America's first research universities, that approach is still around today. So I think you come to a very special place in terms of the university. At large, the university at large, we host nearly 20,000 full-time and part-time students. And we have a little bit, we have 3 major campuses here in Baltimore. Hospital campus, the East Baltimore campus where you're sitting and residing right now. Homewood campus, which is in Charles Village. And Peabody, which is a smaller campus, but still important nonetheless. But you can see Hopkins' presence here in this Baltimore, Washington metropolitan area. But there are also campuses in Nanjing, China, and Bologna, Italy. And it's really funny. Sometimes I'm in meetings. It's kind of hard to grasp where you are, because you could talk to anyone through the world just through your interactions through Hopkins. Yesterday, conference call about some things that were going on in Bologna, Italy with my colleagues through the university, student affairs people. But you can see we also have 9 schools that comprise this university. But probably one of the biggest things is the economic impact. If you walk around town, you're walking around in this state, we're the largest employer in Maryland. And sometimes when you're working here, it's hard to forget it because we're so decentralized. We kind of get I wouldn't say lost, but we kind of get into our school and what we're doing, and everything's about public health here. In the outside world, we're the largest outside in Maryland. We're one of the largest employers in the state. So I've given you a little bit of history, talked to you a little bit about some things, and I'm trying to just welcome you and warm you up to what's coming today. Today at Visitor Day, actually, let me ask a question. I was supposed to ask this to the last slide. Usually during this session, the March session for admitted students, a smaller percentage has already decided. Just want to see by just a show of hands, how many of you have decided that you are coming here to Hopkins next fall or summer? Show of hands. All right. Dean Terrett's coming back too. All right, I like that. All right, so we got a little bit better than a third of the group. So I guess we've got some work to do to convince a lot of others of you, okay? So with that in mind, visiting us today, this is your chance to get to know who we are, and for you to know who we are. It's almost like the job interview. You know, you've been offered the job, and now you want to check it out. So you have the opportunity to take a look or listen to a lecture and participate, to learn the ins and outs from your department. I think one thing that's very important you should pay close attention to in your department, as I said, we're extremely decentralized. A lot of what happens in the school is around and involves your department or your program. So what do I mean by that? There's a school at large, but a lot of the things that happen academically are determined by your program or your particular department. So as you're there, ask the questions, get some of the nuts and bolts things out. Also, while you're here, hear about our services. Stop in offices, or there's a fair a little bit later where you get to ask some questions. Take a tour. The one thing that always remarks on me, I just always have to talk about, no matter where I go, about this school, is that I get to talk to people who do some things that I never would have thought about, say, 20 or 30 years ago in terms of work. I mean, what types of things, am I talking about? I just think about a couple of microbiologists I've talked to in my time here. And, as a guy with a different type of background, literature and administration is like my training and background, I have a very different approach, and I never thought of lab work as being so creative and so team-oriented. It was really shocking. And when I talked to this particular faculty member, actually this was a biologist, Roger McMecken, his excitement on his face about what he does was just something. So I think as you tour around, I would ask you to ask the questions and ask people about what their passion is, what excites them about being here, because I think that passion will definitely rub off on you. All right, a little bit about our seminars that are going to happen, the lectures. Joel Gettleson is going to talk a little bit about the Healthy Stores Project. We've had an intern working there. I think it's really interesting concept. I won't get into the details of it, but I think it'll be really interesting for those of you who may have interest that way. Dean Terrett, who is going to talk to you about the epidemiology, law, and policy of gun violence prevention. The Center for Law and Public Health, as well as the work that happens around guns and violence prevention, is I think is looked at and talked about, throughout the country as people look at these issues. Last but not least, I think you saw a little tidbit on this probably in other places. The Center for Communication Programs. I hear and I talk to people throughout the world, and they talk about, wow, you guys have these very creative programs to change behavior around health. And I would say one of the things that I always hear about, one of the cornerstones of that is CCP's programs. So you'll get to hear from Stella Babalola a little about what they do in that area. I feel like there are 5 million things I want to tell you about, but I only have a couple minutes, and I know Leslie's going to say, Mike, it's time to move on. And she's giving me the signal right now. Okay, so a few things that are happening around campus. You can always check on our website. We always have great people being recognized for their work. You can just take a look here, just what's noteworthy these days. But one other thing I would say about the school in general is our students, our faculty, and our staff are on the go doing work that's shaping policy, that's working in the field, and working with health departments and all sorts of things that are going to impact and make change in communities, not only here, but throughout the world. A little bit about our student organizations. There's 40 student organizations, opportunity to join, and there's not 40 university student organizations. I'm talking about right here in the School of Public Health. So it's really exciting. Our students are very passionate. I'm glad I got that espresso today, because that way I can pick up my pace. A little bit about what some of our alums are doing. One of the things I will tell you as you read that list, our career fair is one of the Mid-Atlantic's largest public health career fairs. We see some of the top employers coming to seek out our students for jobs. Not that this is all about jobs, but I know it's going to be important when you make the type of investment you make here. All right, so the individual who's going to welcome us today, Dr. Burke, is a fellow associate dean. His role works with public health practice and training. He's a former deputy commissioner in New Jersey, commissioner of health. And just being from Jersey, I think he'll have some great stories to tell you. But he's a guy that you'll see not only around this town, but in D.C., that is really trying to influence policy to improve health. And one thing I would say that's probably the most important thing I think you should note about Tom is that he is a 4-time recipient of the Golden Apple Award for outstanding teaching. And why is that important? This award comes from students saying, this is what we think is a great teacher. This is what a great faculty member is. So, with no further ado, I'd like to welcome my colleague, Tom Burke, to the stage. Thank you.
One minute. Okay. They give me the mobile mic because I can't stand still, which drives them crazy when they're trying to video because I'm always. But welcome. This is great for me to have a chance to talk to you. But I want to take a minute today, because this is also a very challenging day for public health. I'm sure you woke up and you saw the news. And how many of you are from California? Yeah, well, everything's going to go okay, I'm sure. And why? Because there's a lot of public health professionals right now. I don't know if you saw the emergency preparedness folks reporting live from Hawaii. And our hearts and thoughts are certainly with our colleagues in Japan, where they're dealing with a massive public health emergency. And one of the amazing things about Hopkins also is, well, first of all, you'll always remember where you were the day of the great earthquake and tsunami in Japan. But you will remember so much about this place as you come here, because starting when you start here, you are attached to world events in a way that you really don't have that privilege and insight before you begin as a public health professional. Because right now, and I'm sorry I'm not going through my slides, they're going to go nuts with time, but I think this is important, because right now there are public health professionals being challenged to understand the impact of health. First question about any disaster is how many people are injured, or how many people are hurt, how many people are gone. Incredibly tough. Epidemiology, emergency medicine, risk communication, all these things come together on a day like this around the world. And it's our responsibility to be on the front lines. One thing that really makes me feel like well, maybe I shouldn't be in academia, maybe I should be out there, is I heard that they're evacuating around one of the nuclear power plants in Japan, and I've actually been there in New Jersey as we had to make decisions during the 3 Mile Island disaster. So public health is incredibly exciting, but you also need a toolbox that is incredibly integrated and multidisciplinary. And so bottom line is, I am a dean at Hopkins. This is the place to get it, all right? All right, so I just wanted to say that because I like to, I really enjoy what I'm doing. And today's not a day to make a lot of jokes, but I'm going to make a couple of jokes too. So, but understand that there's time to be serious and there's times to really enjoy the amazing aspect of what we're doing. Hit down. I'm hitting it. Okay. Name of the school. Got you. All right, so here we go. So anyhow, welcome. You got in. All right. I never got to come to orientation or accept a suit because I didn't get in. I didn't go here. Went to the University of Texas, got my MPH there, checked it out, but actually back in the Jurassic Age when I was applying, Hopkins didn't accept folks who were working I was a teacher, I was a social worker, but I didn't have a medical degree. I didn't have an advanced clinical degree. And back then, this was not a place where I would have been eligible for the MPH. So luckily, I didn't give up on my quest to study public health. But you are very fortunate now because I think as public health has grown, our recognition of the many professions within public health have also grown. So you will have colleagues, fellow students from all kinds of backgrounds. And so maybe not all of you have seen, which is my favorite movie. You can tell a lot about a person from their favorite movie. Anybody know the name of this movie? Napoleon Dynamite. And so there's Pedro, with cool hair, and Napoleon, and they're planning something very difficult, and he has to give a talk. Right, it's the final stage of the campaign for presidency of his school. And do you remember? So Napoleon did that great dance, but Pedro gave a very brief talk. And do you remember what he said at the very end? He said, "If you vote for me," think about that, because I'll tell you the answer later. It's not a quiz. So, as I mentioned, it's a great time to be in public health, and it is a challenging time to be in public health. And on behalf of our dean, Mike Clagg, I wanted to welcome you. Mike is a great colleague and a great leader, and he has the insight to really understand the broad range of public health from the clinical services side to the prevention side, and luckily for me, as the first dean of practice, the practice side. There's incredible opportunities here. All right, you've heard a little bit about the history. I always say the greatest thing about Hopkins, and the thing that keeps me here, I have had 2 careers. You saw that I was Deputy Commissioner of Health in New Jersey, and so I've been on the front lines almost half of my career, and then I've been here. The faculty and students and the colleagues here are what keep me here, what makes this place so amazing. So you'll have a chance to participate in research and obviously the coursework, but also practice and service. There's incredible opportunities here. We have a deep history going back, and take some time to see some of the exhibits just behind this wall of the founding of this school, established in 1916, a model which brought together, we used to be the School of Hygiene and Public Health, which brought together practice and research. And in many ways, the school right now is rediscovering those roots and emphasizing those kinds of things. And our mission is the discovery and application of knowledge. So we're not just a renowned research institution. We also know we have an obligation through education and through translation to improve the practice of public health around the world. So today, it's a big place. We have about 2,000 students from all over the world. And that's probably the most amazing thing. At 11:30 today, I actually am meeting with a student and a colleague from Japan. And I just BlackBerried my assistant to say, are you sure we're going to have this meeting? Because we were going to talk about risk assessment and emergency preparedness. I know I'll remember this day, and I know that they'll remember this day as one where you cannot have too many tools, too much knowledge in public health to address days like this. So, as you might see, we're a big place with 550 part-time faculty. As you're checking out some of those other schools, and I went to one of those other schools, so there are many, many options that you will have, and I want to say that, but there's just something special about here, and if you look at the numbers, it's the kind of place where you can focus on a particular area, customize and integrate different disciplines, and also work with colleagues all around the world. So our research, and actually there are many more of those red balloons than that because it keeps changing. And this one doesn't show New Jersey, but we actually have some stuff going on there too. All right. So how do you judge? How do you select? So no disrespect to other schools. Other deans might say, you know, we're number one and all that. I'm not going to say that too much, maybe a little. But so some of you might be thinking, well, how does Hopkins measure up in terms of grants and contracts? And you may have heard of some of these other schools. There's one that begins with an H here. It's trying. It's good. Columbia, University of North Carolina, Chapel Hill. Of course, Texas is great, and where my daughter goes, at Drexel, is over here, but they're moving. So it's all about trajectory, too. But I just wanted to show you an important indicator. Well, why is this important? Because that shows the faculty and the students are competitive. They're on the front lines. They're involved. You've seen the website. You know we have 10 academic departments and so many different certificates for degree-seeking students and different types of master's degrees and doctoral degrees. This is a place where you can really address your interest and, more importantly, address the needs of the public health community. And I'll just quickly show you the departments because as dean, I've memorized almost all of them. It's overwhelming. But they're all part of this puzzle. And I hope what you will take away from here is not only a rich collection of new colleagues and mentors, but also an understanding of how these aspects of our science come together to make public health better. We're also involved in practice and service. On Monday, we'll have the Commissioner of Health for the City of Baltimore here in a student-sponsored panel to talk about the vision for public health in Baltimore. We're engaged in practice and service locally, nationally, and you will have the opportunity to be a part of that. You'll hear about our community-oriented SOURCE East Baltimore Community Program and the coursework that will allow you to be part of that. So why should you enroll here? Well, so the first part of the presentation, that was kind of data-rich, and that's what deans have to do, show you the bar charts and things like this. But now I'm going to speak from the heart a little bit, all right? So what's really great about this place? And anyone who's had the privilege of teaching here will tell you the greatest resource this school has, the students. Your fellow colleagues are just amazing because the folks sitting in this room within a very short time will be leading the public health charge around the world. You also have, because of our science, because of the fact that we are engaged in the issues that are on the front page of the world's newspapers every day, on the cutting edge of science, practice, and policy. And then you also have this thing of mentors. If you get to a leadership position in public health, I guarantee you, because it sure happened to me, there will be days like this where there's a crisis, and you're going to want to talk to people who can really tell you the straight scoop and bring the best science to you. And I urge you to think about your mentors, because I've been really lucky to have fantastic mentors. I don't know how many of you have gotten a chance to meet Dr. Edith Schoenrook, who's really my public health practice meeting and an inspiration for me here at the school. But on the lighter side of things, my former chair, Don Steinwalks, he's my mentor. And there's always paybacks with mentors. So we were having a party in HPM, and the staff brought him a costume and said, Don, will you put this grass skirt on and these coconut things? So then he comes into my office. I was associate chair at the time, and he said, Tom, help me out. Will you wear this? So there we are, and the rumors have never ceased. But he was a great mentor, and sometimes it takes giving back. So I want to give you now, you know, Letterman gives the top 10. And I want to give you the top 10 reasons, I think, for coming here. The first, I like teaching. I came here to teach. The academic offerings. The chance to learn and build your toolbox. Another thing that's amazing about this place, the opportunities to understand the policy process and the practice process, the translation of that academic knowledge, of that research, into reality. The research, from multidisciplinary, from social sciences, to the most advanced bench sciences, to the communities. A view from the front lines. I have to tell you, I have had an amazing, great time dealing sometimes with very challenging issues. So, for instance, I closed the Jersey Shore, 126 miles shut down, not a soul on there because of contamination when I was health commissioner in charge of environmental health there. That was a day I wanted to speak to some mentors before we made that call. The governor was not happy because it was July. That was huge. I've been involved in issues that you've all heard of in trying to help the folks down in New Orleans after Katrina to understand their exposures through what was called the toxic gumbo, the formaldehyde in the trailers, trying to help shape the way the government makes decisions through the application of the science that I focus on, risk assessment and environmental science, and even here in 2 local communities. So you've heard about that search for weapons of mass destruction in the Middle East that never really turned anything up? Well, I've actually been involved in some work that did turn up some weapons of mass destruction from 1917 down there at American University and the Spring Valley neighborhood outside Washington, D.C. So who are you going to call when you discover this stuff, and it might be a pretty bad risk to the community? Well, I've been fortunate enough to work with that community, to work with the university, and work with the U.S. Army to try and strategize. And also here in Baltimore on many community issues. But I also got to do some amazing stuff. So my kids never thought I did anything all that worthwhile until just a few weeks ago when I got to go on the Dr. Oz show. You know, you can be named to the National Academy of Sciences and endowed chair and all that crap. But then, I also got to do this. Who's from the West Coast here? All right. So anybody know what this is? So that's me. I'm tall, and that's the staff director from a study that I directed at the National Academy of Sciences. And this is actually a huge public health issue that we're standing in the midst of. That's Riverside, California. All right. Anybody want to guess what we're standing in front of? Huh? It's okay. You didn't take the courses yet. It's not a quiz. All right. So half the battle in public health is keeping people away from poop. Right? And even today, keeping clean drinking water in the areas that are going to be hit by the inundation of that flood. That's a huge issue. Well, it's a huge issue in LA. So you don't think about things when you flush, right? Somebody has to think about it. Well, I had to head up a study for the nation to figure out how we're going to deal with now it's banned because of my work in the ocean. We can't dump this stuff in the ocean anymore, so we're applying it to farms. And we have to figure out the science behind that and is it safe. And so we work on society's most challenging problems. You get to work with dedicated people, and through translation, getting the word out, you get to improve public health. Then there's life in Baltimore. Yeah, Baltimore. We don't really have floods like that all the time. If you were here yesterday, I hope you weren't staying in Fells Point and came in a kayak today. You know, I don't know if you like football. The Ravens aren't bad, not as good as the Eagles. There's the food, the bay, and the people. It's an amazing, comfortable city, and we're actually a pretty good school. Did I mention we're in the #1 school of public health? Oh, yeah. I'm sorry to dwell on this, but we are ranked the #1. There's Harvard, and some other. And these are very nice people. But most of all right, I want to appeal to your inner self now. All right? So the Jersey beaches are clean. The California beaches are clean. Imagine you're going to the beach, and what hoodie do you want to wear? All right? So while you're here, I mean, even geeks look really good in a hoodie. That's how I usually come to work, actually. So I want you to think about how you look in a Hopkins hoodie. And think of yourself as a Hopkins person. And then, to get back to that first slide with Pedro and Napoleon, his speech was very simple. And he said, if you vote for me, all your wildest dreams will come true. And I would say that all my wildest dreams have come true. But I can tell you from the day I began, with all those people who talked funny down in Houston, and gave me the cruel nickname of Tex because of my New Jersey accent, public health is amazing. What you will learn, what you will integrate, and how you will view the world will be different. And you will have a chance to pursue your wildest dreams, millions at a time. So, welcome to the Hop. Thank you.
On behalf of Admission Services, we saw all your application materials, and you're in. Good job. So we just welcome you to the school. I'd also like to just point out Taryn Callahan, who's the assistant director here. You have probably heard from both of us throughout the past couple weeks, and you will continue to hear from us. But especially, our goals for today is to answer all of your questions. So if you have any questions, or you're going to have the opportunity to hear from a lot of our deans and our faculty and staff, as well as meet with your departments in the afternoon. But if you have any remaining questions, please don't hesitate to find either Taryn or myself, or another admissions representative as well. We want to answer your questions. So I have the great pleasure of introducing our next presenter, Kojo Osai-Bonsu, a candidate in the MPH program here at the Bloomberg School and recipient of the prestigious Hopkins Sommer Scholarship. Kojo is a medical doctor, a graduate of the University of Ghana Medical School. As president of the Medical Students Association, he helped push through curriculum reform that significantly shortened the time in which students can complete their medical studies. In a country where the doctor-patient ratio is 1 to 18,000, the impact of this positive change is quite substantial. Kojo first became interested in public health through his work as a house officer at the Coral Boo Teaching Hospital, where he routinely witnessed perseverance and heartache. Faucets in surgical theaters frequently stopped running, prompting nurses or orderlies to fetch water stored in barrels. Hospital staff had to ration gloves. Doctors, on many occasions, used their own money to pay for tests or medications for patients who could not afford them. Kojo realized that his impact as a medical doctor, although great, was severely limited by the overall health systems in which he was operating. He hopes to one day act as a leader in the Ghana health service, reforming the system and improving millions of lives. Kojo's dedication and leadership in the field of public health are truly inspiring, and we are thrilled to have him here to speak with you today. So without further ado, please join me in welcoming Kojo.
Hi. Like Leslie said, I am Kojo Osai-Bonsu. I'm in the MPH program, and I'm from Ghana. Kojo is the name given to a boy who's born on a Monday. And I just want to share another minute detail about my birth with you. Even to this day, and in a very affectionate way, my mother will always tell me that I was a very troublesome child growing up. And for her, the reason is very simple. It was because I was born on a very hot afternoon. Are considered troublesome because they come into the world during the hustle and bustle of the day when there's a lot of activity, while children who are born in the still of the night, when everything is calm and cool, are considered placid children. Well, I think that since that hot afternoon of my birth, I've sobered up somewhat. I am a physician by training, and I was drawn to medicine because it enables doctors to make an impact in the lives of their patients and their families, and also empowers doctors to be advocates for their communities and their societies. Like Leslie said, I took on leadership roles while I was in medical school. I was the president of the University of Ghana Medical Students Association, and I was also president of the Federation of Ghana Medical Students Associations, which is the umbrella body of all medical students associations in Ghana. And for me, the lure of going into student leadership was the opportunity it afforded to make a positive change in the school environment. And in my pursuit of the MPH degree from the School of Public Health here, the driving force has been the platform that afforded me to influence and impact millions of lives at the same time. I didn't set out to pursue a career in public health. I was like a lot of my colleagues in my class in medical school who wanted to go into the more glamorous areas like surgery and obstetrics and gynecology. Because the thinking in Ghana is that the real doctor and a good doctor is the one who sees a patient, cut the patient open, repair whatever problem there is in the patient, sew the patient back up, and then the person gets up and walks away healthy. So that was the mindset I had when I was in medical school. And indeed, in Ghanaian medical circles, public health is considered a field that doctors who are not very good fall to. And just so that you get an idea of this perception, I'll tell a story. There was this doctor who was posted to a town in Ghana, and he was going to be there with another doctor who had been stationed there and had earned a reputation of being a very good doctor because he was good with delivering babies by cesarean sections, he was good with hernia repairs, and he was also good with laparotomies for acute abdomen. Well, when this new doctor got there, he didn't quite set off on a very good foot because the surgeries he performed, he lost the patients within the first week of surgery. And you know how a small town environment is. Very quickly, word spread like wildfire, and this doctor earned a reputation of being a bad doctor. And indeed, families would like to send their relatives who were ill to the hospital in the nearby village if they got wind of the fact that this bad doctor in quotes was on duty. Well, there was this night when a woman who was pregnant and had gone into labor was rushed into the hospital. The midwife, upon initial assessment, told the woman that she would need an emergency cesarean section to deliver her child. And the woman asked the midwife which doctor would be performing this surgery. Well, the midwife lied to her. She told her that it was the good doctor, while in actual fact, it was going to be the bad doctor in quotes. What the midwife didn't count on was the fact that the woman knew the good doctor and the bad doctor. So when the doctor walked in to assess her before going to surgery, the woman recognized I was the bad doctor. And according to the story, this woman screamed, got up from her bed, naked, heavily pregnant, and in labor, and ran into the darkness of the night for her dear life. You know, the story goes that the doctor was so shaken by the incident that he left the village, he stopped practicing, and guess what? He went into a career in public health. So, I mean, when I was in medical school, there was a bias I had at the back of my mind against public health. And when I left medical school, I was really excited to have reached the impact point where I could begin to see patients and impact lives. You know, in medical school, all you get to do is observe, and occasionally somebody will hold your hand and teach you a procedure. But now, I was at a point where I could begin to make an impact on the lives of the patients I saw. So I was really excited. And as a member of a team of doctors, I helped restore health to a lot of patients. And their joy at getting health gave me a sense of contentment that I was doing something worthwhile with my life. But I soon noticed that whatever impact I was making was hugely limited by the system within which I worked. I lost a number of patients in the emergency room because we did not have the emergency medication in stock to administer to them at the time when they came in and most needed them. We resorted to writing prescriptions for their relatives to go out and buy the medicines, and most times the relative came back only too late. I lost patients also in the emergency area, mainly because we had beds that were choked. So patients would come and then we wouldn't have beds, and I'll have to stand there and watch helplessly while they were turned away. The hospital is the largest teaching hospital in my country. It's called the Kolebu Teaching Hospital. But we had only one functional obstetric theater. So pregnant women will come in and they'll be lined up in a line, and each one will await her turn. And you can well imagine the consequences. They were very dire. So it was at this point that I felt that the hospital administration had failed in creating the environment that would enable someone like me, a doctor, and other health professionals to make the impact that we always wanted to make. And I also felt that as someone who had worked in the wards and knew the situation there, if I were to go into hospital administration, I'll be able to create the environment that will be optimal for patient care. I felt that as an individual doctor, seeing patients on a one-on-one basis, the impact I could make was very small compared to the impact I could make as a hospital administrator, helping to shape the system so that a lot of people could benefit from it. So it was that point that I decided, and it was also that point that I knew that I wanted to pursue a career in public health. And at that point, all the prejudices I had at the back of my mind against public health didn't matter anymore. For me, at that point, public health was a higher calling. Well, I shared my desire to pursue a career in public health with my colleagues, and every one of them said that if it's going to be public health, then look at applying to Johns Hopkins School of Public Health. It is the best in the world. Well, yeah, it is, and it also shows just how highly regarded the School of Public Health is beyond the borders of the United States. So I did apply. And I also, for backup, applied to some of the other schools that were shown on the slides. And after months of waiting and some amount of anxiety, here I am in the School of Public Health, pursuing what I want to do. This school is great. There's a great array of courses that are offered. One of my recurring regrets, and a regret of a number of my colleagues as well, is the fact that we will not be able to take all the courses we would love to take before we leave the school, because there are just so many, and our time of stay here is only so limited. The faculty is equally great. I'm sure you know about Al Sommer, and you know about D.A. Henderson for the legendary work they've done, and they are rightfully famous. But every faculty in this school is renowned in their fields. Marie Dina West, is a great lecturer of biostatistics. And Prof. Steve Terrett, seated over there, is an excellent teacher of health policy. You've experienced Tom Burke, he's one hell of a teacher. And we have John McGrady, a very entertaining lecturer. And the list goes on and on. Well, when you come, you experience them, and you can tell for yourselves. There's also a great diversity in the student body. And for me, that has been the big thing. Since coming here, I've met students and faculty who know more about my own country than I know about it myself. And it is no exaggeration to say that if you picked one country in the world at random, you find a student here or faculty here who's either from there or has done some work there. There's an equally great diversity in reasons for enrolling in the school. In my interactions with my colleagues in the MPH program, in the master's programs and the doctoral programs, reasons are varied. Some are here because they want to move on to medical school. Others are here fresh from residency. There are others who are just, taking programs so that they can go into residency. There are several others like myself who are public health all the way. There are some who are training to go into the business of medicine. And there are others who are training in epidemiology and biostatistics. And this is the best place to get that kind of training. I've taken classes with somebody who was in a rock band once. I've taken classes with a Navy diver, with a lawyer, with a journalist, and several other professions. And the good thing about it is that everybody comes to the discussions in class with a different viewpoint, so that when you leave a class, you know that you saw it one way, but there are several different angles to it, and it just broadens your understanding and knowledge of whatever it is that you are studying. And just so that I drive home the point about just the quality of people you meet in class, I'll just give this incident that happened to illustrate it. I took a course only recently in negotiation and conflict management. And it's quite a didactic class, so there's a lot of interaction between students and the faculty. And then we do a lot of role plays as well. And during one of our breaks, I fell into discussion with a classmate who works in the office of one of the vice presidents of Hopkins. So she asked me what I was interested in. I thought I was really passionate about hospital administration. And then she was like, oh, I know this administrator in the hospital who takes people for fellowships, and I think you'll be a good fellow. Well, I didn't say that, she said it. So I could recommend you, so that she'll take you on for a fellowship this year. I haven't taken her up on her promise, but it just shows the interactions you have on a daily basis with your colleagues in the school. Very soon, my time here will be over, but every day in this school, I find myself growing. Every day, I know I'm inches closer to my main objective, which is becoming CEO of our hospital someday, very soon, and leading positive change in the hospital. And I'm confident that Hopkins is giving me the skills and the tools to go out and protect health and save lives, millions at a time. Thank you.